first park to reopen will reopen. But guests must wear masks. They will have their temperature taken, and employees are right now being trained in what they're calling contactless guest interactions. Sounds like fun. Erin?
All right. Thank you very much, Nick. Out front now, Sanjay Gupta, Dr. Sanjay Gupta, and Dr. Ashish Jha, director of the Harvard Global Health Institute. So let me start with you, Sanjay. You know, when we hear about the coronavirus task force being phased out, and they want to do that over the next few weeks, and Vice President Pence says, well, we're going to transition this back to the federal agencies. Is the task force useful in terms of, getting them all in a room to do that in one place?
Yeah, I think it is useful. And you thought about during Ebola, for example, there was a czar to sort of coordinate that federal response. I think it's important here. Objectively, I think it's important. Subjectively, I think it's also sent a message of, seriousness, of gravity around this and help translate some of these more difficult medical concepts for the public, which I think has been really important. And keep in mind, Erin, on March 16th, when they started the pause and these briefings and more earnest, there were some 4,500 people roughly with the confirmed infection at that point, and around 70 people had died. I mean, you see the numbers. It's 1,000-fold now in terms of deaths. States are reopening. I worry that this is all sending the wrong message. Disbanding the task force, states reopening. It feels to many people like it's over, and it's not.
And well, that certainly is the message it sends, Dr. Jha. I mean, do we still need to hear from the doctors on a regular basis? And I guess I'm wondering if maybe the reason that we're not hearing from them is they would maybe be saying what you're going to say or what Sanjay just said, and that's not the message that the White House wants out there.
Yeah, so I think abandoning the task force at this moment is a terrible idea. What most people need to know is I think we're sort of at the top of the third inning of a 9-inning baseball game. We have a long way to go. And this is not when the coach walks out and says, we're done. And that's basically what we're seeing at this point. And I think it's not going to be useful. Yes, states are going to continue to have to play a big role, but we have a long way to go on this pandemic. And a lot of people are going to get sick, and a lot of people are going to die. And we need a really effective federal response, working with states. And I'm deeply worried that if we stop hearing from Dr. Birx and Dr. Fauci and we stop having a coordinated federal response, things are going to get worse, not better.
I mean, Sanjay, look, at least 20 states right now are seeing a growth in case numbers. And as we just pointed out, I remember asking you, 10 days ago when we, was there any way that we would be at 74,000 deaths as they were projecting the White House task force by August? And it was obvious that wasn't the case. And now we passed their number by August today. I mean, we're right there. We're right there. I'm sorry, we're a couple thousand short. But states are moving ahead with those plans to reopen. I mean, Dr. Fauci summed it all up this way, Sanjay.
How many deaths and how much suffering are you willing to accept to get back to what you want to be some form of normality sooner rather than later?
What will Americans accept? I mean, Sanjay, I asked that in the context of if 2 months ago you had said 70,000 Americans were going to die of an infectious disease in the next 9 weeks, would you be okay with that? Nobody would have said yes. And now people are opening up and it seems saying yes.
This is a really challenging question, Erin. I mean, I don't know. I think you're absolutely right. I think it depends in terms of, in some ways, of how it's presented. I've taken a very strong stance and not sort of creating these equivalencies, like to say that's 2, 747s a day, maybe 3 a day of passengers who would be dying. That's what the coronavirus is doing. And I don't like to present things in those stark terms because people should just, sort of recognize that this is serious and that there's something that can be done about it. I mean, I think it's probably the same for Ashish as it is for me. I've known people who've died of this, Erin. I've been in hospitals and I've seen people struggling to breathe because of this. And I think for a lot of people who've not seen that, this still feels like something that they're immune from, that they don't have to pay attention to, that they're not worried about, that they think it's not a risk to them. And, thankfully, there will be a lot of people who won't, get sick. And that's obviously a very good thing. But right now, I think not only are people's health potentially at risk, but how I behave could potentially put other people at risk. How they behave could put me at risk. I mean, people talk about being risky and taking a sacrifice and starting to get things open again. Well, you're not just risking it for yourself, you're risking it for me as well, and for you, Erin, and for Ashish. So, I think it's a different sort of, metric that we have to think about this.
So, Dr. Jha, the number of new cases per day in the United States has largely plateaued, albeit, as Sanjay points out, at a level where, he makes the 747s comparison. You're having a 9/11 a day. And you think about the response in this country to that. But when you compare the plateau of where we are to other countries like Italy, Spain, and France, they have these huge outbreaks, but then their curves did sharply drop. Why isn't that happening here? Do you think it could happen with the reopenings that are about to go on or not?
Yeah, so one thing to Dr. Fauci's comment about how much suffering are we willing to live with, let me just make one quick comment on that. I think it's a false choice between do we want our economy open or do we want to save lives? I think there is a third path, right? If we had spent the last 3 months building up a fabulous testing, tracing, isolation infrastructure where we were doing testing all the time, we could open up our economy and not have 3,000 Americans, 2,000 Americans dying every day. So we have just chosen not to do the thing that gets us out of this bind. And now we've presented this decision of, which of these two horrible choices do you want? In terms of what other countries have done and how Italy and Spain have brought their numbers down, they went into full lockdown. I mean, in Italy, everybody was shut inside for 4 weeks. You could only go out for the bare essentials. We kind of did it halfway. We still had spring break, and you had those spring breakers partying on the beaches. You had some states that never really fully shut down at all. So we have had this very mixed approach and not much testing or not enough testing, and no surprise, we made some progress, but we didn't make as much progress as we wanted. We kind of did this halfway.
Sanjay, final word.
Yeah, I mean, the other thing is there is a plan. There is criteria, that has been put forth that states should follow. I think that's gotten lost in this conversation, seeing this 14-day downward trend, like Ashish is saying, making sure that testing is in place. I mean, there are countries that have had success. I mean, New Zealand, I think yesterday got down to basically no cases. It's obviously a much smaller country. These downward trends in countries in Europe, it is possible. This doesn't have to be the way that it is. But it has to be the way that it is for a bit longer. I think that's the point that I think these public health officials are making.
All right. Thanks to both very much, as always. And out front next, Trump's ousted top vaccine official, Dr. Rick Bright, now says that he warned about the pandemic repeatedly and was ignored. What else is he alleging tonight?